Well, welcome. My name is Ronnie Shure. I'm the president of the board of directors of Healthcare for All Washington. So thank you for joining us tonight. We're going to look into the Oregon's path to universal healthcare. Healthcare advocacy groups in both Washington and Oregon have been meeting to share our victories along the pathway to universal healthcare and the bumps in the road as well. uh, a coalition called One Payer States, a national coalition that represents states all across the country, have inspired us to build relationships. Our two states have called this process building bridges between Washington and Oregon, which is a sore subject in some people's minds, a difficult subject. Uh, then the next meeting of that bridging group is going to be in September in Olympia. So thank you for joining us tonight. Just like me, you too can volunteer for Healthcare for All Washington. I'm participating in this Zoom meeting tonight from the lands of the Coast Salish peoples. Please take a minute to acknowledge peoples in the lands where you are joining us from today. We acknowledge all of the ancestral homelands and traditional territories of indigenous peoples who have been here since time immemorial. Unlike the current national leaders of our country who are selling off our lands for profit and for possible destruction, we respect the efforts to preserve our lands by the Coast Salish peoples of the Duwamish, Muckleshoot, Puyallup, Suquamish, and Tulalip nations. So, Ron, if you can stop that main screen and spotlight Michelle Glass, well, I'd like to introduce her. And Michelle, if you can unmute
Good evening.
and let's see if I can spotlight you. Ha! There you are. Michelle is crossing the virtual bridge from Oregon to join us here in Washington tonight. She's the public engagement member of the Oregon Universal Health Plan Governance Board. She's a policy and advocacy coordinator at the Regional Health Equity Coalition of Southern Oregon, although Michelle just told us she's moved around, so we'll have to adjust that map a little bit. She has 2 decades of experience in grassroots policy and community engagement at both the local and the state levels. She will update us tonight on the progress that Oregon has made. We have been watching and cheering for the Washington Universal Healthcare Commission, but we know our neighbors in Oregon are moving along the pathway to affordable, high-quality healthcare. And I think that you'll see Michelle's passion as she gives this presentation tonight. So welcome to Washington. And let's take it away. I will disappear, right?
Thanks very
Ron,
much, Ron.
can you make me disappear? Whoosh. And I'll go ahead and start the slides.
Great. Thanks, Ronnie, and thanks, Healthcare for All Washington, for having me tonight. I'm really grateful to be with so many dedicated advocates who have been working for universal healthcare for many years, just like in Oregon. And I want to say that our board that I sit on today would not exist without Healthcare for All Oregon. So your work really matters. And really, yeah, honored to be able to be with you all. Like all of you, we stand on the shoulders of so many people who have been working for universal healthcare for decades. And we know that we have an important piece to play in this relay, and that there will be people who continue this work beyond us. So I'm really, really always glad to be with advocates. As you could hear from that gracious introduction, those are my roots. So want to start off by saying that, yes, I'm joining you from Lapine, Oregon, and it is beautiful here in the high desert, and we are in the Confederated Tribes of the Warm Springs lands. And I guess I'll start there. Like all of you, I am passionate about this work because I have been impacted by it in many ways, both personally and on a community level. And I work every day with people who have experience with barriers to healthcare, whether it's financial or not enough providers in their rural community or some other barrier, language barriers, cultural competency. There are many ways that our current system does not serve our communities in the way that we all know that it can and it will. So next slide, please. So as I mentioned, we are here because of advocates in Oregon. Advocates in Oregon have worked really hard on policy advocacy like you all are working on, as I can see from your incredible website and strategic plan. And the most recent victory for Healthcare for All Oregon is Senate Bill 1089 in partnership, of course, with hardworking legislators in the Oregon State Legislature. And this bill created the Universal Health Plan Governance Board, which I am one of 9 members. And that board brings together people who have different types of experience. There are some members like myself that are focused on public engagement, and there are also members that are coming at this work from the other important lenses like healthcare providers, healthcare policy, healthcare financing. And then in addition to the 9 members of the governor's elected board, we are part of a group of 57 dedicated Oregonians that sit on not just the board, but all of our committees, which I'll talk more about in detail later. So this is, and we're all volunteers. So this is really a collective effort that builds on the work of the task force, the Universal Health Plan Task Force that existed before the board, and that created a draft framework for us to work from. So starting with a little bit of that background, and also, credit where credit is due, we are right now in the middle. We were seated last February. We were officially formed in February of 2024 in terms of just orienting for timeline. And we have a deadline to submit our final report to the Oregon State Legislature in September of 2026. So we have roughly $1.5 million in our initial biennial budget to build on, like I said, the work of the task force. So the task force created a framework, which I have in a slide here for us to work from. And then our work was to build the operations, the plan, what would be covered, how it would work, how it would interface with the current system that we currently have, and the way that we would finance that plan. We also were asked to do some strategic targeted engagement once we had that draft plan in terms of what the plan would look like, what would the covered services be, and how we would pay for it. The board is to take that draft plan and engage healthcare employers who provide healthcare to their employees, health plan folks who work for insurance companies and the coordinated care organizations that provide Medicaid services in Oregon, as well as healthcare workforce voices, and ask folks basically, here's our draft plan. What do you see working? What do you see that could create unintended consequences? What do you want us to know as we think about this? And then bring that feedback back and incorporate it into an updated plan that will then go to the legislature as a recommendation. So that is the work that we are currently engaged in. Tonight, I'm going to give you an update in terms of where we stand in that work and the structures we've put in place to support achieving those goals. Next slide, please. So in Senate Bill 1089, there were values that were cited. These are values that Oregonians hold dear. I'm sure they will be familiar to many of you. And they also reflect a ballot measure that Oregonians passed that made healthcare a right under the Oregon Constitution. It was a constitutional amendment. So that is reflected in the legislature or the legislative bill language as well. We actually took the values and principles that were laid forth in the bill, which were fairly high level, and we really supported them. But we created an ad hoc work group and went a little farther. So on another slide, I'll actually talk a little bit more about our values. But of course, public transparency, making sure that we're honoring the public funding of a universal plan as a public trust, making sure that there is no room for discrimination in the universal plan that we're designing, and that it really honors the fact that healthcare as a fundamental right must be accessible to everyone in a way that it is not currently. And we also centered equity in the work that we're doing. So again, we took these values that were in the legislation and we articulated them a little bit more. Next slide, please. So these are, again, the principles that were laid forth in Senate Bill 1089, which created the board. It lays out some principles such as provider choice, making sure that people can choose the providers that work best for them as long as they meet basic licensure, certification, registry requirements, making sure that there's no, again, no discrimination against providers, in addition to no discrimination against healthcare consumers who are accessing care. And then making sure that decisions stay with the folks accessing care and their families and not with the state. And trying to create a plan that's going to meet the needs of folks throughout the lifespan. Next slide, please. So this is our board roster and our staff. We have talented staff that are housed in the Oregon Department of Consumer and Business Services that support the work of the board. So all of us and our bios are on our website. If you need to get in, if you want to reach out or get in touch with us, we're happy to be in touch. And we are just now recruiting for our executive director position, but we have we've been really lucky with the staff support that we've received. And they will probably be your first point of contact if you reach out to the board, but they will connect you with us. Go ahead to the next slide.
Michelle, I think Bruce Goldberg's picture is a little dated. I've known him for a long time.
He is ever young, as you know, if you know Bruce. But yes, we're really lucky. Bruce was on the task force and brings a lot of institutional knowledge of this effort, as well as, of course, his other body of work. We're really lucky. We've got an incredible group of folks.
Well, especially the Medicaid changes with the CCOs that happened, 12, 13 years ago. He was heavily involved.
Yes, he's not new to changes in healthcare systems in Oregon. So yes, we have a great group of folks, great board. So in terms of the progress to date, what we've accomplished since we were formed, it did take us a little bit of time to, basically what we're focused on is creating a really strong proposal that can go to the legislature that sets Oregon up so that the next policy opportunity that presents itself for implementation, where we know that we can get what we need in terms of waivers or funding or all of the things that we're going to need to put this into operational implementation in Oregon. We want this to be thoughtful, careful, methodical work. We don't want to rush it, right? And so we really made sure that because we had board members coming from so many perspectives, providers, folks like Bruce who've been involved for many years in healthcare transformation in Oregon, as well as people who work directly with communities who are not currently served well by the system that exists today. We made sure that we had brought everyone up to speed, reviewed the task force's recommendations and framework that we were building on. And then we also wanted to get clear on our ethical framework and our values and principles that would guide this work. And so we were lucky to have Dr. Chenwei Chi joining us for that work. And he brought a lot of academic knowledge and expertise also from his work around the world in guiding the implementation of other universal healthcare plans. We dove into some of the complicated issues that were thorny issues that Plan Design Committee is wrestling with right now, like ERISA and how do you create a revenue plan? How do you understand how our current patchwork of publicly funded healthcare systems are funded? And what does it start to look like to build a unified plan that brings those pieces together within current law? We developed a work plan, which again was really affirming the as a starting point, the work that the task force had done before us in terms of what that plan would include and look like. And then we did recruitment for our committees, and we were so pleased. We had 166 applicants, and we right now have 47 members appointed in across those work groups, and I'll show you what that structure looks like. And then we did submit our first status report to the legislature in December. And as I mentioned, we are just now finishing up a process for recruitment for a new executive director. So next slide, please. The principles that we worked on, that kind of refining and adding to make sure that they could fully support implementation of this work, were first and foremost health equity. So recognizing that the inequities in our current system, the way that the system is broken, has real world effects and cumulative effects over time. And that creating a plan that gives everyone the exact same treatment is not going to get us to equal outcomes, that we really need an equity approach, and we need to understand health equity and center it in everything we do, from plan design, from finance and revenue design, from the way that we approach communications and community engagement to get feedback on the plan, to actual implementation and ongoing monitoring. We also adopted as an overarching principle maximizing health for individual fulfillment, as well as making sure that we are creating healthy communities and a healthy population across the state. We have an urban, I don't know if y'all are familiar with something called the Urban Rural Challenge, right? So in Oregon, just like in Washington, we have urban areas and rural areas that have different needs. So we talked a lot about fair distribution of medical resources. We really want to make sure that financial hardship is minimized from medical bills, that is no longer the leading cause of bankruptcy for Americans or Oregonians. And finally, a real community sense of ownership and governance, both of the plan as it's being developed and the actual plan as it's being implemented and utilized. Next slide, please. So I won't go through the full preliminary structure. I will send out the slides to Ronnie to share with all of you. But again, this is building on the work of the task force, and this was our starting point. It is currently with the Plan Design Committee, and they're refining it and hoping to have a draft plan by this summer. And so this may look slightly different. This is a working document, and they're having lots of in the weeds conversations about what this looks like and what it needs to look like in order to serve those principles I just covered. Next slide, please. So for visual folks in the audience, this is a visualization of our timeline in terms of where we're at in the work and what is planned to come next. So as I mentioned, we did that phase 1 foundation building. That is this purple bar here. So this first kind of row is 2024. So that's last year. So we had our building in the foundation phase. Then in 2025, this whole year is proposal development. And again, that's that iterative work between the proposal for what will be covered is being developed in one committee. Proposal for how we pay for it is being developed in another hardworking committee. And then the committee that I co-chair with my colleague, Amy Fellows, is the Community Engagement and Communications Committee. We will be taking those draft plans out to a targeted list of groups that the bill directs us to get feedback from, and then bringing that feedback back to those committees to refine those drafts. And those drafts will become the proposal that we submit to the legislature. So that's going to take the rest of this year. And then next year, we'll, I would imagine, be finishing up incorporating some of that feedback and also writing our final report, which is due to the legislature in September of next year. Next slide, please. This is another visualization that is a little more granular. So it includes the committee work broken out by committee. So you can see here at the top, it's just a timeline from July 2024 all the way to September 2026. And it includes community engagement, which started meeting last fall, the community engagement work stream through our work group or our committee, as well as the communications work stream, which also sits with our committee. Those committees are up and running and have been meeting since fall of 2024. Finance and Revenue. This is the committee that is tasked with creating the plan for how we will pay for our universal plan. Plan Design and Expenditure Committee, which is taking that task force framework and refining it and putting it into proposal language. And then operations. So how are we going to run this plan when it has been implemented? We also have, starting this summer, we are planning another work stream and that group will be tasked with creating kind of the concrete plans for how we get to where we are, to where we need to be. And then you can see our final report here. Next slide, please. This is more detail, and again, I won't walk through all of these work streams, but this is broken out by deliverable, the expertise that each work group has, and the timeline for each of these work streams in the committees that are moving those work streams forward. So this is kind of the structure that we're using to move forward this very large, complicated piece of work. And although it is distinct work streams, these, as you can imagine, are all very iterative. So we are needing to be in constant communication with each other. And there are pieces of work that are going to start with one committee and then be passed off to another, back and forth as we refine. So these are certainly not siloed work streams. But they are focused work streams. So communications and community engagement, finance and revenue, plan design and expenditure, operations, and then transition and implementation. Next slide, please. So this is just a little bit of detail for what each of these committees look like. Each committee has deliverables and a work plan. Each committee has 1 or 2 board members who serve as chairs or co-chairs. And then that recruitment was really broad, and it brought in all kinds of expertise and lived experience from across Oregon. These meetings are remote, so we already able to hear from folks from across the state, and I think that's really a strength. We also have interpretation built into our meetings. So for example, in the Community Engagement and Communications Committee, we have a member who speaks Spanish as their primary language, and so we do have an interpreter for every meeting, and that allows us to make sure that we are hearing from all kinds of important perspectives on the ground doing this work: healthcare service provision, health policy, health equity work, community organizing work, community engagement work, and that's been really critical. Next slide, please. Finance and revenue, committee members, the deliverables here. This is really core to what the bill tasked us with, creating a unified financing strategy for the plan and doing some economic analysis. So we are securing contracts with some contractors who will help us do some of that economic analysis. And the committee is really hands-on guiding that work. Next slide, please. Plan design and expenditures is the other committee at the heart of our deliverables to the legislature. Really looking at all of the complicated weeds around benefits, eligibility, what reimbursements look like, how we contain costs, financial modeling and actuarial analysis. Again, we're bringing on some really great consultants that will help us with that. But this is a committee that has just really taken on this huge body of work in fleshing out that kind of framework that the task force came up with to figure out what it would look like to actually put it into practice. And between plan design and expenditure and finance and revenue, these 2 work groups are creating the draft plan that then the communications and community engagement work group committee will take out for public engagement, targeted community engagement, to get some feedback over the summer and the fall. Next slide, please. Operations is really about how we are going to stand up and run the independent public corporation that Senate Bill 1089 calls for to run the health plan once it is operational. Includes all of the things that would entail, such as, organizational structure, the staffing, et cetera, and also looking at what types of things we would need to, what governmental entities would we need to work with and who would we need to request authority from in order to do all of that. And it does include federal waivers as well, doing some research on what would be needed. Next slide, please. Transition committee has not been formed yet, but it is something that we have planned for. And we had some board members arguing for including Bruce Goldberg, and I'm really grateful because I think this will be a really helpful piece of our report to the legislature to make sure. So that is slated for later this year to be recruited for. Next slide, please. We have dealt with a lot of complicated pieces of law or current ways that the system is working that we'll need to find a way to incorporate. The Employee Retirement Income Security Act, or as we lovingly all refer to it as ERISA, is one of those pieces. And it's something the board has been looking at really closely, especially the plan design portion of the board and the finance and revenue portion of the board. This is a federal law that preempts states from regulating employers' choice about whether or not to provide benefits. And so we do believe there's a path forward, but we're working closely with experts on ERISA to make sure that our plan will be fully compliant and not subject to a legal challenge. Next slide, please. We've also been looking at health systems financing, as you can imagine, as part of designing these components that will go into the draft plan and go out for some public engagement in the summer and the fall. And we just had a presentation at our last meeting from Chen-Wei Chi, and all of our meetings are recorded and put on our website if folks are interested in that. It was an excellent presentation. Next slide, please. So all of the committees, with the exception of that transition committee, have been recruited for. They're up and running. They're meeting monthly. Some committees are meeting twice a month. Those are all public meetings. Folks are welcome to watch those meetings live or watch the recordings. We are finalizing contracts with contractors that are helping us to move some of these really big pieces, like the actuarial analysis, as well as some of the community engagement with specific stakeholders as called for in our enacting legislation. We have a new executive director we expect will be starting in April. And we are working towards those draft plans this summer to take out for public engagement. And because public community ownership of this plan is so important to us, we know that it's important to the success and the effectiveness of a plan to make sure that the public feels ownership and like they've had voice in co-creating it. That is something the board has emphasized from day one. So next slide, please. And with that, I think that's a quick update of who we are, where we're at, where we've been, where we're headed. And I'm happy to hand it back over and look forward to answering questions.
Well, thank you, Michelle. How do I get spotlighted again? There we go. So thank you for offering up those details, but I hope you will add the participants here will add questions about those details to the chat. We will make Michelle disappear for about 5 minutes while she and John Sobek, a volunteer, will prioritize those questions, and then we'll come back, bring you back, Michelle. So don't go too far. But let's spotlight Peter Lucas, our treasurer. Peter will magically appear. Ta-da, ta-da! Little drum roll.
Almost there.
Almost there.
Hang on just 1 second. So yeah, I'm tasked with the fundraising pitch, which we do at all of these meetings, and to tell you why you need to donate. And I want to thank you, Michelle. We're very inspired by your work and your organization and the commission, which sounds quite similar to what we're doing in Washington, and sounds like you're making great progress. Our organization, Healthcare for All Washington, has supported legislative actions since we were established in 1994, and our real focus is on single payer. Obviously, we've had a bill in the legislature before, the Washington Health Security Trust, which is a bill to create something maybe similar to what you have in mind. Our talented professional lobbyists, as well as our board members, volunteers, and supporters, maintain close contact with many legislators, providing education and guidance in drafting bills and enlisting allies in the Capitol Olympia. And we are fortunate to forge strong bonds with many of these legislators who support our mission and work to bring it to fruition. These activities, of course, require financial support in terms of personnel, outreach efforts, and administrative support. So please help us to continue this work by making a donation tonight. Our goal is $250, so we'd like to achieve that goal tonight or even more. And I've posted several links in the chat to donate. I'll continue to do so. And for those of you who've contributed in the past and continue to help us with ongoing support, monthly support, we thank you very much. And encourage those of you who do support us to make monthly donations, because that'll help us throughout the year. And together we can achieve cost-effective, high-quality, universal health care coverage in our state. So thank you so much, and take it away, Ronnie.
So Peter, thank you for your contribution to Healthcare for All and your leadership. You've been entering that our website in the chat, so please feel free to go in there. It's not too late to add another question or two, so if you have a question, go ahead and add that. But thank you very much, Peter. We'll make you disappear now. And let's bring back Michelle.
Hey, Ronnie and Peter. I don't know what we've got for donations so far, but I'll match the first $100. But my $100 won't go towards the 250 goal.
Thank you so much. Really appreciate it.
So, Ron, can you spotlight Michelle and John Sobek?
So I have a few questions. Get this up and tell me when I'm ready.
I'm not able to do spotlighting because I'm spotlighted.
I don't know if you have to spotlight, but I can bring up a
There's
couple
John,
questions to start.
and now
Oh,
Ron,
there
if
we
you
are.
can
Yeah.
spotlight Michelle. We're almost there.
First question, which is probably a pretty easy question. How long ago was the constitutional amendment making healthcare a human right? And what percent majority did it require in the legislature?
So this was passed by voters. It was a ballot measure in 2022, and it actually was like 50.73% or something like that. It was very close, but it
Yeah.
did.
Okay, great. And then next question is, let's see. Excellent presentation. The legislation that created the task force was very clear and specific about creating a single payer system. Is that true for the governance board as well? And then the second part is, does the legislature direct your group to design a single payer plan? Or did it mention single payer specifically?
So the enacting legislation defined a single-payer healthcare financing system as a universal system used by the state to pay for the costs of healthcare services and goods. So I think it does. The legislation does mention single payer, and one of the things that our committee is really engaged in is we know that the plan design and the Finance and Revenue Committee are going to make recommendations based on their research. We're learning from other states that have been doing this work. We're going to hear from Oregonians when we go out to do public engagement. But we also know that there's incredible expertise in terms of how we frame this work, and that the way we frame it matters. At the Healthcare for All Oregon annual meeting last year, we had Patty Wentz, who is an incredible healthcare communicator and an expert in strategic communications, talking specifically about some of those things about if you poll people on the exact same plan in terms of how it works and how it's financed, and you use universal versus single payer, you get different results. And so I think we're also really committed to doing no harm in the way that we communicate about this. And so we're going to be hoping to make some strategic communications frameworks and talking points to help to present this work in a way that hopefully doesn't activate biases that people have when they hear some of these terms. So all of that, yes, it's in the legislation, and the way that we frame it will be informed by some of our work with some of these communication strategists.
Good, perfect. Right at the end of the presentation, we had a little run of questions. One of which is, as envisioned, what will be the relationship between the board and the independent corporation? And I'm going to add a little bit of color to the independent corporation. Does it have to be an independent corporation, or could one of the payers in Oregon bid to run that separately?
It has to, according to the legislation, it specifically has to be an independent corporation. It's envisioned as a nonprofit. And as of now, we believe that that independent corporation will need to be separate. It will probably a different staffing structure, a different structure altogether than the board that we have now. So we don't envision it necessarily. The decision hasn't been made, but it's not just an easy, like the board will become the corporation type of idea. We're really looking at what would the needs of a corporation like that be to be fully supported and implemented and run in the way that it needs to be. And starting from that as a question mark instead of, starting with what we currently have with the board.
Thank you. Oregon has always been a leader in Medicaid waivers. How does potential Medicaid funding changes affect your plan?
That's a multi-million-dollar question, right? I think that the way there was also a private message, and I want to acknowledge that, about asking similarly, impacts on this state program from what's happening with some of the uncertainty in the federal policy landscape, especially when it comes to DEI, since we do have health equity as one of our central commitments. So I'm going to kind of combine my answer to both of those questions, since you can't see this private message. But I would say we believe that this moment creates incredible opportunity because it is bringing to light for so many more people. It's widening the circle, right? It's bringing more people into the movement because more people are seeing the breakdown, more people are seeing the need, more people are feeling the ways in which the current system does not meet and increasingly will fail Oregonians, Washingtonians. And so we think that it really helps to make the case for a system like what we're designing. And we believe that it is our duty to do careful, thoughtful, methodical work now, because even though we may not get a waiver if we apply for it tomorrow, that opportunity, when it arises again, and for folks who've been doing this work for decades, there have been moments of expanded opportunity and moments of constricted opportunity. This might be a moment of constricted opportunity when it comes to things like federal waivers or support for what we're doing from the federal government at various levels or from various agencies. But if we build this plan now, it'll be ready to implement, and it'll be so much quicker to implement when that moment of opportunity comes again. And we believe that between doing this work and also seeing the growth in people getting involved in this work now, we believe that we are actually making really good progress towards that day.
Great, thanks. I'm going to combine a couple of questions. Who are the contracting actuaries for the benefit design? And also, who are your contractors for economic modeling?
Those have not been publicly announced yet, I believe. So I cannot, we're involved in state contracting processes right now, so it's not something I can share at the moment. But that will be public record. It'll be shared out in a board meeting as soon as it's publicly available.
As a person that's contractor with the state, I know that's complicated.
Yeah.
I've done that before. Okay, a couple more questions. Is the board using a subcommittee structure to accomplish its work? And if so, what are the subcommittees and their scope?
Yes, we actually spent all the committees that I talked through in my presentation. And again, I'm happy to share my slides. We are doing our work through subcommittees, and we have 47 members aside from our 9-member board who are engaged in those subcommittees, bringing perspectives, expertise, lived experience, and really helping us move that work forward. And it's expanded our capacity so much by having, instead of one board meeting every month, we essentially have, some subcommittees are meeting twice a month. So yes, absolutely.
Right. There's a question. It's really a statement, but I think there's a question. Are you looking at similar structures to Oregon's SAFE, SAIF structure, and are you looking to replicate it?
It's something that has been mentioned as a potential model of inspiration. Again, we're really preliminary in the envisioning and fleshing out of what that public corporation would look like. So we'll have to see where the conversation goes, but it's something that is being considered and looked at for sure.
Great, thanks. And one more question. I don't know if you're following what other states are doing. New Hampshire got a long way down the road until all the hospitals united to kill it. And I will say, as an aside, New Hampshire also has a very good universal vaccine program, but that's I've been involved in that business for a while. How involved are the hospitals in the Oregon current plan?
So the part of our task is, as the board, is to build on the work of the task force. The task force did some public engagement, and some of the hospitals, the insurers, including both the CCOs and folks like other kind of private insurers, and healthcare workers were the folks who were less engaged at that point, less responsive to the invitations to focus groups and those types of things. And so that is part of why we are working with Diana Bianco at Artemis Consulting. I can announce that one, who has extensive experience in working with healthcare partners in Oregon, and generally well respected, well regarded, and really targeting some of those folks to engage with them, knowing that they have some insights and some information that we want them to understand fully what we're proposing, and we want to hear from them in terms of what they see working and not working. But in terms of involvement in the current board and its subcommittees, I'm not aware of a lot of engagement from the hospitals.
I know with my work with Oregon, they're going through budget cycles right now, as is Washington. How are you working to get more funds committed from the Oregon legislature to continue this work?
So we are embedded under DCBS, which is the Oregon Department of Consumer and Business Services. We were rolled into a DCBS agency budget, and DCBS did request on our behalf 1.9 million for the next biennium, which is 0.4 million more than we had for this current biennium. So it is an increase for our work. With the timeline that we're working with, I think that there's not a lot of scope that we can increase from our current scope that's laid out in SB 1089. And so I'm really hoping that we can deliver strong work for the deliverables as laid out in that legislation with the funding that the legislature is supporting us with. And then I think there will need to be a really robust and well-funded next phase. And that part of our role will be laying out that pathway and making strong recommendations for increased investment from the legislature to support that work. So we'll see. We're in the middle of the legislative session now, and budget conversations are ongoing.
Right, thank you. I'm going to ask one big question, and then we'll open it up, I think, for other questions. What are the board's major challenges to complete their work before September 15th of 2026?
I mean, everything I presented on, essentially, it's a huge undertaking to piece together to replace our patchwork system with a system that would serve everyone from birth to death, every resident in Oregon. It means that we have to wrap our heads around all of the ways the system is working and not working now, and come up with a proposal for how we could provide those services in a unified way. Similarly, how do we create a grounded, implementable, fiscally sound plan for how we're going to raise the revenues to fund this, and make sure that it saves folks money, right? That is one of our goals, improving health and saving money. It sounds really easy in terms of our principle. We all believe in it, but making it work on paper, these committees are working incredibly hard, meeting multiple times a month to try and get these draft plans written. So I think that's the first hurdle. And then I think, we need to at a time when everyone is distracted and dealing with a lot that is imminent. We are asking folks to sit down and review these plans and give us feedback on this plan that will be implemented, not tomorrow, but as soon as there's an opportunity. And I think that will be an incredibly important part of this work. And then the final challenge will be, we all want to do broad public engagement. I think all of our hearts and values are where we would want to take this draft plan and hear from everyone. We don't have the resources or the time to do that. And so we're going to have to make some really tough decisions and do targeted engagement where we'd really rather do really broad engagement. And I'm hoping that'll be part of potentially a future phase that the legislature may fund.
When I was involved in Oregon healthcare leadership, including when we brought, I don't know if you're familiar with the um, Emergency Department Information Exchange that moved from Washington into Oregon. It's now Point Click Care. How do you get all of the Oregon people who are involved, like the Oregon Health Leadership Council, which includes all hospitals, all health plans, all systems, all health systems, and even some of the major provider groups, to like understand what you're working on, and how do you get them on board?
You give me the softball questions now. So one of the first things that the Community Engagement and Communications Committee did was compile a list of all of the existing places where people convene and meet and have conversations about healthcare, health equity, health policy, so that we know who to reach out to when we have these draft plans ready to share. The other thing that we did was we mapped all of the existing pieces of kind of landscape analysis and feedback, like the community health assessments that every county does. Lots of times the hospitals complete those as well. The community health improvement plans across the state, really doing a scan for what feedback has already been shared. And so we were able to leverage, we're really trying not to reinvent the wheel. We want to honor feedback that's already been given, make sure we're building off of knowledge that already exists, and tapping the networks of folks who are already really deeply engaged in healthcare provision, healthcare policy, making these systems work, and communicate effectively with them. So those were some of our first tasks. We did complete that fall of last year.
Great, thanks. All right, that's a bunch of questions. Anybody else?
I do just want to make it clear that although I am here I am a board member, and the board is of course aware that I'm speaking with all of you today. I am also just speaking as an individual. This is my perspective on work that I'm engaged in. So this is not the official policy of the board, but the board, I will report back to them, and we're all really grateful that you all are following our work, and we look forward to learning from you and sharing our work with all of you as well.
Michelle, that brings up one more question. I mean, Oregon and Washington are two states that share a border. And as a doctor that used to practice in Vancouver, Washington, and took care of patients from both Portland and Vancouver, and operated in Vancouver and in Portland, you have any ideas about what we could do to work together to make sure that, this is not just an Oregon issue or a Washington issue, but maybe a potentially multi-state or regional issue?
Yeah, I think that Oregon and Washington have a long history of innovation and close collaboration. I think, for us in this moment, upping the scale of complexity and the scale and breadth of what we're doing, I think it's daunting to think about, but I definitely think that sharing information, resources, challenges, successes has been instrumental to our success. We also did a scan, not just of Washington, but of all the states and what they've been doing for universal healthcare, single payer efforts, and really learned a lot from that. And so we hope that there will be more conversations like this as we both move forward.
Great, thank you, Michelle. I'll turn it back over to Ronnie.
Well, thank you, John, and really thank you, Michelle. You didn't really need to add a disclaimer at the end. We expected, some perspective, and we really are glad to have you show that passion you have for universal health care. It's public engagement, the role that you have on the Oregon board is a critical issue that we have been trying to collect or work with the Washington Universal Healthcare Commission on a way to really keep that communication going. They certainly read every public comment, but that doesn't necessarily lead to a dialogue. It's very hard. So thank you for that passion. The disclaimer was not even needed. I think we all enjoyed that. So thank you, thank you, thank you very much.
It was my pleasure.
So I want to thank y- uh, uh, the volunteers that helped make this happen. Thank you, John, for leading that Q&A and pulling questions together. To Ron Lovell, Rich Legoo, D.W. Clark for helping make this happen. A couple of really quick announcements of upcoming activities. Next Wednesday night, Physicians for a National Health Program in Washington will have a conversation about how you can get involved in health equity for immigrants. Leachy from Northwest Health Law Advocates will be joining us there. There will be a rally because of to point out the danger of budget cuts, that we don't balance our Washington budget on the backs of the vulnerable. So if you are available, join us in Olympia. Join all the healthcare advocacy groups in Washington. We'll be marching to Olympia on April 2nd. And the Washington Universal Healthcare Commission is involved with another video program or Zoom program that will be Friday, April 4th. The RPEC, a retired public employees union, our organization will have a Zoom meeting with a national leader on single payer, Rose Roach from the Labor for Single Payer organization, will be joining with some members from our Washington Universal Healthcare Commission. So go to RPEC sites or find, a comrade in arms at an RPEC who's a retired public employee, and we can share that with you. You can also find it on our website and on all of the websites of healthcare groups. And want to we still have the donation link available in our chat, so please feel free to grab that and save that link if you're able to make a donation. We appreciate it. And thank you to everyone who has donated tonight, and to John Sobek for offering a little inspiration. And we did reach that goal. So thank you all.
You reached 250?
We raised 260 so far. So yes, yes, yes.
Add my 100
And
to that.
uh, and it's just so powerful to see so many people join us tonight. Thank you, Michelle. Thank you to all of the people in Oregon. I see a number of people who have also followed that virtual bridge. Thank you for your support for the work that we're doing in our state. It's the more people that are organizations are doing it, the better. So thank you all very much. We'll call this meeting to an end and please plan on joining us again on the second Wednesday speaker in April. Good night.
Thank you from Southern Oregon.